Welcome, everyone. We appreciate you being here today. And from our side of the computer and what we see, there are going to be about 60 of us on this call today. And we're really grateful for your participation. Just know that you won't see yourselves. You will see the panelists and the folks who are talking. And we won't see you, but we are very grateful that you are here. And we look forward to not only sharing information with you, but more importantly, taking your questions and having a dialogue virtually. So welcome to our, what is formally number 6 of our Corona Conversations in partnership between our foundation, the North Shore Community Foundation, the St. Tammany Chamber of Commerce, and St. Tammany Corporation. Hopefully most of you know that the session that was scheduled for last week will actually be now next week because we canceled it because of the storm, obviously. But just to do a brief recap, so everyone knows how we got here today. So far we have done, again, 5 of these. This is our 5th, and we have focused on the economic impact of Corona, obviously beyond the healthcare impact of Corona and what it means for St. Tammany Parish, both now and moving forward. So the first one was on public budgets. The second session was on healthcare. The third session was on workforce and education. The fourth session was on commercial property, focused on office and retail developments. And then obviously this is our 5th. The one we have rescheduled is on quality of life and hospitality. So we're very grateful for you being here today, and also know all of those prior sessions are recorded and available on all of our individual websites to watch. And they have been, if you haven't watched any of them yet, really remarkably informational, and I found them really helpful, and also sort of a mood perspective. We all tend to go into these things and while there has been lots of scary news, there has been a lot of good, promising silver linings to many of our conversations. And so hopefully today in this conversation, we will find those silver linings as well. Our format for today is going to be similar to the last one, where we will do a brief presentation. 4 or 5 of us are on a panel here. I'll introduce everyone, and we'll do 3 to 5 minutes of presentation. And then we encourage you and ask you to submit questions to us in the Q&A section of your Zoom platform, not in the chat. And we'll read them from that Q&A section. I'll read them out loud. We'll answer them, and the panel will discuss them. So again, we are very grateful that you're here, and we're going to go ahead and get started. Let me introduce who in general is on the call today, and then I will call on everyone one by one. After I do a brief introduction of the things that the foundation is seeing and a big picture of what we're seeing from a community needs perspective, focusing obviously on the nonprofit sector, I'm going to introduce Terry Turner Marsh, who is the CEO of the North Shore Food Bank. Obviously, Terry will focus on the hunger and food insecurity as it relates to both immediate needs and long-term, and what she sees for our region. After that, I'll introduce Sonia Newman from the United Way to speak to the ALICE population, the folks that United Way really does a remarkable job, both focusing on providing services for, supporting services for, and advocating. So Sonia will talk about that population. After Sonia, Christy Ross, who is one of our partners from the Baptist Community Ministries Foundation. They are a tremendous funder here on the North Shore, specifically in St. Tammany. And for today's context, their focus is on healthcare, obviously, but both physical health and mental health. And Christy will have a lot to offer in that space. And then lastly, we'll round out with Nick Richard, who those of you who know will also, I'm sure, entertain us in that space, but share information which will probably be more startling than many of us realize about the long-term implications of the mental health realities of COVID and how that's going to stay with us for a while longer. So with all that said, again, welcome and thank you. Big picture, here's what we at the North Shore Community Foundation are seeing. In general, this will surprise none of you, we're seeing a significant uptick in specific needs and programs. Terry obviously is a great example of that, food insecurity, et cetera. The other side of that, in general, that is a more painful statistic to share with you guys, is fundraising the way we knew it before March 13th of this year has changed, is the nicest way I can say it, stopped in many ways. We don't believe it'll be that way forever, but two things have happened. One, clearly, people are fearful for their economic future, and so they are holding on to money that they previously felt was disposable, and so they're holding on to more of that. And secondly, our parish is a very event-driven parish as it relates to our nonprofits and how they fund their work. And so obviously with events being canceled from March now through the end of the year, virtually every nonprofit in town has seen a dramatic impact to their budget. So that is very real, and I think it's part of what we'll talk about today and what the information others will offer. But when we're talking about the economic reality of the pandemic and what it means for community needs, because I sit in the foundation chair, and that chair is about developing and sharing resources with those of you who are delivering incredibly critical boots on the ground missions, we are concerned. One of the things that concerns us the most is reflected in the slide. Jessica, if you will call up my first slide. So without putting dollar signs on it, I want y'all to look at something. About 3 weeks ago, I asked the team to run some math for me. And I asked them to run the total contributions to our organization. And for those of you who don't know how the foundation works, we hold individual funds for donors, groups of people, companies, you name it, individuals, families, and they deposit money into those funds, and those funds serve a little bit as charitable checkbooks, and then they make grants out of those funds to the nonprofits in this region and beyond doing important work. So in March through August of 2019, the blue is the representation of that number. I will tell you that number was almost $1 million. Okay, we're not putting exact numbers here, but that blue last year represents close to $1 million. In 2020, the exact time frame, exact days, that's how much was deposited into funds here at the foundation. The blue was into funds other than our emergency relief fund. So the bulk of the money that's been deposited in 2020 has been into the emergency relief fund. That money has been granted out. But I want you to see the stark comparison of money in last year versus money in this year. And what troubles our team the most about that is the way our pattern works is typically what donors do this year into their funds are more than likely going to be going out the door in a 12 to 18 month time frame. So what this statistic is showing us, and I hope this graph proves to be wrong, is that right now the money that would fund grants next year isn't here yet, and we're not sure if and when it's coming. So that's a really troubling slide for us because, again, everything you see in blue is typically what we would be writing in checks to you guys. That is the portion of our work that is strictly fund management. That's scary. On the bright side, if you will, is the next slide. Our board, after a lot of questions, and our donors, our fund holders, if you will, asking a lot of questions, our board decided to engage the Small Business Development Center at Southeastern to do an extremely in-depth study of our nonprofits that we are referring to as vitals. And it's going to be a detailed analysis of the implications of the 2020 pandemic on our vital North Shore nonprofits. We've identified 150 rather, nonprofits in the entire North Shore region that we are going to do this deep dive into. It's going to survey and research their economic impact to the region, both pre and post COVID. It's going to look into their programs and the increase and or change of their missions and needs for their missions. It's going to look at their needs, financial, staffing, otherwise. We're going to look at their current financial condition, and as importantly, we're going to look at their expected 2021 financial condition. And then it's going to look at some other elements of moving forward. What are their needs beyond money? What are the changes they see coming for their organizations beyond money? We're really excited to get this information because, first of all, our fund holders want to know this, but our partner funders want to know this. I think all of us as a community want a deep dive on where we are. So many of you on this call are in that number of 150 North Shore nonprofits who will very soon be contacted about working with us to get that information. So that's where we are. That's what we're doing moving forward. We'll obviously take questions later, but bringing it back to the reality of COVID immediately, now 5 months in and moving forward. Terry, tell us where you are, what you see, and what you need us to know.
First of all, I just want to thank Susan and Lacey and Chris for the opportunity to share with everyone what we've been seeing in the food bank world. For those of you that are in St. Tammany Parish, you know we're located in terms of food banks and pantries throughout the region, primarily located in Bush, Covington, Lacombe, Mandeville, Slidell, and even in Pearl River. The thing that was interesting with this pandemic that was different from what we had dealt with, say, with the floods of 2016 and 17, there was incredible demand. About 75,000 more pounds of food were coming into our region on a monthly basis and going in and out of our doors. But we had the added dimension of trying to keep people safe. This was huge in our environment because a big piece of our human resources to get our jobs done comes from volunteers who are early retirees, who have, unfortunately, some of the underlying conditions that could give them the propensity to develop COVID rapidly. So a lot of us had to basically determine how are we going to operate. We relied on each other. Some of us collaborated with each other to cover the entire week. We had a food bank which did close because of exposure and quarantine. We had others that just simply made the decision to close altogether because the risk was too great. But with all that being said, we also had those that continued to operate with heavy demands. With all of the complexities that came with COVID, the social distancing, the age of our volunteers, the group size, what we had to do and had to do quickly was learn how we were going to pivot around all of this. Many of us closed all of our lobbies and we have to register people to get our services. So we were doing inline car registrations. We were basically reducing our group sizes in our warehouse with our volunteers as well as with staffing. We were doing what a lot of you guys are still doing now in terms of remote work. And then the other thing that we needed to do, because as you can imagine, the community at large really wanted to come in and help. And we had to limit our volunteers to certain dates, certain timeframes, and our groups as well, because we didn't want to introduce unknown vectors that could potentially carry the disease. The positive things that we had happen, though, is as a result of moving towards this contactless distribution where our participants and clients were having to self-load, we had to develop a system in which we were performing home deliveries. And we did that with the community. We collaborated with church groups, civic groups that basically came to our doors, picked up our food and brought it and did porch deliveries. One of the things that I think all of you have experienced, that we in particular experienced, was food supply. The food supply was basically, the chains were broken, if not significantly impaired. We typically get purchased food from our local grocers. Our food that comes to us, USDA food, comes through Second Harvest. A lot of us are partner agencies of Second Harvest, which is a Feeding America affiliate regionally. But what we were finding is that these grocers locally were being limited in terms of the amount of space that they could take on shipping containers. So they had to basically respond to their own stores and their own customers before they responded to our needs. The other thing that was pretty interesting to us as well is that with the government's moving into that federal program of Farmers to Food Box, that was really great for our participants. They were getting more perishable food than they'd ever gotten before. But the issue became for some of us that, hey, how do we stock these pantries? So we were having to purchase more and more food to the tune of about 20% increase in cost because we weren't utilizing those local vendors. And consequently, that was even further exacerbated to some degree when we started having shortages. I mean, you guys are well aware when you went to the grocery and you were looking for a specific product and it wasn't available. Well, take that and put it in the food bank world where I or a food bank need, 50 cases of green peas and I can't find them. So what we were having to do is move towards national chains, whether that was ePallet or Sysco, things like that. The can shortage that has gone on has created some issues for us so that now our ordering patterns, instead of ordering 2 to 4 weeks, we're having to project 8 to 12 weeks out. We had to very quickly determine how we were going to deal with an uptick in the Latino population. The use of your phone and translators just didn't cut it. So we were all recruiting for Spanish-speaking volunteers to help us with that. Moving forward, we are still sustaining about a 30 to 40% increase from what we had pre-COVID. The food availability, though it is not where it was, for the first time, at least locally here in Covington, we were able to order a regular order from our local vendor. So our hope is that this is going to continue. Our biggest issue has been and will continue to be making sure that we have the food and the human resources to feed the people that are coming to us, as well as identifying and hitting those pockets that we don't see through our home delivery programs that we may have. The community, I have to say, was outstanding in the sense of not only in terms of the food that they brought, but their willingness to help, the funding that was provided from foundations such as NCF and other groups and associations as well as the grants and contributions that we received in the community. Our goal is to continue to serve everyone who hits our door, to not at any point in time run out of food, and to continue our current programs as we are doing right now. And I can turn it back to you, Susan.
Yeah, thanks, Terry. I think everything Terry said doesn't surprise us, and we'll go through everyone, and then we've already got some questions related to that. So stand by, Terry.
So I'm with United Way of Southeast Louisiana. Just to give you a little background on our United Way. We are a 7-parish United Way, and here on the North Shore, it's St. Tammany, Tangipahoa, and Washington parishes. That covers part of our service area. We've been around for 95 years now, and we're just really glad to be part of the St. Tammany Parish community. And our credo with United Way is we fight for the health, the education, and the financial stability of every person in every community. And our mission is to eradicate poverty. And we also want to create an equitable community where all individuals are healthy, educated, and economically stable. So everything that United Way does is focused on that. So, when y'all hear me talk about things, think about those standards that we're looking at: health, education, and financial stability. Those are the pillars of the work that we do in the community. And in talking about COVID, a group that we even were looking at before the pandemic is a group that we call ALICE. And whenever I'm talking to groups in person, I always ask people, do you know who ALICE is? And people look at me like, I don't know ALICE. But I promise you that each and every one of you knows ALICE. And ALICE can be a man or a woman. ALICE can represent a family. It can be someone who's young, someone who's old, someone who's Black, someone who's white. We all know someone who is ALICE. So United Way focuses our work and our programming on supporting initiatives that will help ALICE to do better. And so Jessica, if you can pull up my first slide there, please. And while she's doing that, I'll just let y'all know who is ALICE. ALICE stands for Asset Limited, Income Constrained, but Employed. So ALICE has a job. ALICE is paying taxes. ALICE is someone who is definitely part of the working community in St. Tammany Parish and in all of our parishes in Louisiana. United Way, in association with the Association of United Ways, Louisiana Association of United Ways, did what we call the ALICE report, where it looks at the financial, basically, stability of individuals in our communities. And y'all can actually access this full report on our website at unitedwaysela.org/ALICE, and you can go into more detail on there. But ALICE, like I said, they're asset limited, income constrained, and employed. Their income is above the federal poverty level, but it's below the household survival budget. They're usually individuals who are in low-paying jobs like cashiers, maybe some healthcare workers, security guards, laborers, office administration, childcare workers, people who are making minimum wage or maybe even a little bit more than minimum wage, but they don't have the opportunity to save for emergencies or investing in their future, which could be like education, which would help them to get those higher earning wage jobs, home ownership, which makes their life more stable, not only for themselves, but for their family, and then preparing for their retirement. And one thing that COVID has done, as well as like if a disaster came, is ALICE, if they had a financial setback, it would be really difficult for them to recover from that situation. And ALICE definitely lives in all areas of St. Tammany Parish. This graph here is showing y'all when we first started looking at the data for ALICE to now. Our most recent data is for 2018, just because it takes time to get all of the data in. About 43% of the population in St. Tammany is either what we consider to be ALICE or living in that definition of that federal poverty level. So it's almost half of the residents in St. Tammany Parish. So, you know, one thing that Terry was saying is, you know, there's definitely silver linings, right? So almost half of the population is considered to be ALICE or living in poverty, but that also means that the other half is not. And so that's where you all who are listening can certainly help, not just United Way, but our different nonprofit partners and the nonprofit community. Is for those of you who are able to help financially or with your time, you know, we certainly hope that you will. Next slide. And so this is just showing y'all, what does it actually cost to live in St. Tammany Parish? You know, when we talk about wages and what people earn, that FPL, the federal poverty level, that's basically what the government definition is of poverty. Anyone who's making, a single person, $12,140 a year for an adult, and for a family, it's $25,100. And I'm sure that our friends at the food bank can attest that there's a good bit of people who fall into that category. And so those individuals actually qualify for certain social services. But then there's also people who make too much, and that's who ALICE is. They make too much to qualify for these different social services that are available, but they still don't make enough to make ends meet. And when you look at the household survival budget in St. Tammany, and you look at the things that go into it, such as housing, childcare, transportation, healthcare expenses, and you look at the wages at the bottom line, you can see that for a single adult, just for them to be able to maintain that survival budget, they need to be making at least $14 an hour. For a family that has 2 adults and 2 children in childcare, because I'm sure many of you know childcare is very expensive. They need to be making almost $40 an hour between the 2 of them just to make ends meet. This does not give them any wiggle room for savings or emergency situations. So, and you could take it off the slide now, Jessica. But so what this shows y'all is that, you know, people were struggling before COVID for sure, just based on wages and jobs. But with the pandemic and the loss of wages and the money that's going back into our economy, it's certainly affecting Alice even more. And, you know, just to let y'all know some of the things that United Way of Southeast Louisiana has been doing, and we're continuing to pivot as needed. That seems to be the word of the last 6 months. Is, you know, right when the pandemic started, we contributed to a fund that a foundation had to support nonprofits in our area. And then also, and the main reason we did that is because we didn't want to duplicate services in that arena. But then we started our own fund with the Louisiana Hospitality Foundation to support hospitality workers, because that seemed to be, at the time, the industry that was most seriously affected in the immediate needs. You know, who would have thought at that time that this would still be going on? And I have some of our funders to that on the phone or on the call. North Shore Community Foundation made a gift to support that initiative through your donors and your funding. So we thank y'all for that. And Baptist Community Ministries did as well. So what we did there is we were able to provide emergency grants to individuals that worked in hospitality, whether they worked in a restaurant or a hotel or catering, and provide them with an immediate $500 cash grant that they could use to pay their rent, for groceries, whatever their immediate needs might have been at that time. And they had to go through a screening process to receive that funding. So that was like one of the immediate things that we did. And, you know, looking to the future, you know, United Way, our programming, and one thing with United Way is that we know we cannot do this work alone. That's why we have our United Way partners, because we know that they are the experts in the work that they do. And so we want to support their ability to do their best work with funding. And then we also have our own internal United Way programs. So a thing that is very important to us is that we are able to maintain our funding to our current United Way partners. We're currently in year 2 of a 3-year cycle, funding cycle. And our United Way, we did have to make some big changes so that we can continue that commitment through this year 2 funding cycle. Internally, we had to make some cuts of employees, unfortunately, and cuts of hours and budget cuts and all that kind of stuff, because it is so important to us that we are able to maintain that funding to our nonprofit partners that are providing the programming that supports this Alice community. And then another thing that we're doing ongoing, because getting back to work is very important as it relates to the pandemic, is we partnered with Loyola University New Orleans College of Law and launched the United for Early Care and Education. That's also in partnership with the Agenda for Children. And that is giving technical assistance to child care providers that are at risk of closing permanently due to COVID, because we know if we want our workforce to be able to get back to work, child care is going to be super important there. So I'll just leave it at that for the time being, and we could come back to me later. And
thank you. I'm sure we'll have questions. We'll circle back to you shortly. Sonia, thank you very much.
thanks.
Christy, if you will turn your camera on, and I'll sort of tee you up. For those of you who don't know, Baptist Community Ministries Foundation serves 5 parishes. St. Tammany is the only North Shore parish in their footprint, but they really are a remarkable partner over here. For those of you who don't know them, you should. So I will tee that up as my introduction of Christy and let her talk about what they're seeing, what they know. They have a lot of data, a lot of good information, and a lot of good people and resources. So Christy, tell us what you're seeing.
Absolutely. Thank you so much, Suzanne. And thanks to all of you for joining. Unfortunately, I can't see you, but I'm happy that you are able to join and to really discuss a very critical topic. And I'm going to echo what Suzanne and what Sonia as well as Terry said. And I think the needs are, of course, pervasive throughout our region, but also throughout the state and even in some of our national calls that we've had with national philanthropic organizations. The needs are very similar. So I'll just kind of echo what was said. Food insecurity, certainly something that we have heard time and time again from our partners, those who are partnering with food pantries, as well as those who are serving people, maybe through other avenues or for other sources of support. So we've got folks who are doing work more focused around Opportunity Youth, for example, or we have folks who are really focused in the social services sector, and they're saying, listen, Christy, before we can even offer services, folks really need kind of that most basic need of food and housing. And so we're looking at food insecurity, housing insecurity are two major issues. The other two I want to point out, early childhood education. Sonia made a really good point, and we've been hearing that from the field as well. We saw that in the nonprofit survey, that it's really going to be difficult to reopen the economy if we don't have adequate seats and we don't really shore up that early childhood education network to be able to support people in their return to work. So another big need. On the behavioral health front, we're a health legacy foundation. We also are a faith-based foundation. And so we have been seeing a lot in the way of behavioral health, and not just in those who have severe and persistent mental illness. We've heard a lot from our charter management organizations, the schools locally, as well as private schools, that are saying, we're seeing more of a need because our kids may be registering more on the level when we think about for depression, for suicidal ideation. And so that's really unfortunate, because we knew we had a huge behavioral health challenge prior to COVID. And I think what is happening, and what a lot of our educators and our schools are saying, is that we're noticing that with our kids. And so kids who may have been well-adjusted and fine and everything, they've had to really undergo a lot of change. And so depression is one that I know many of our partners are really concerned about. Now, I've given you kind of all of the doom and gloom, as I don't want to paint the picture as just completely of concern or one that's more of a negative one. There are things that we're doing, and of course doing in concert with partners like United Way, partners that you all have on the North Shore, in particular St. Tammany Parish, which we serve. BCM, since March, we have made investments or emergency support to the tune of $1.6 million. So that was over and above our Transom grant process that many of you may be familiar with. So the board did a really excellent job of saying, listen, we're going to run our normal Transom cycle. We're going to award $1 million in grants for the spring, but we're going to do another $1.6 million. And those funds went to partners like United Way to really help gig workers, folks in the culture economy, but also we made a gift to Second Harvest to address the food insecurity work that they were doing, and really to help, as Terry mentioned, really with the cost, the lead time that's needed now in order to fill up the pantry and respond to the need. So we were really proud to do that. And then we also did an enhanced emergency award for all of our grantees who expressed a desire to get some additional funds. So we have over 70 grantees currently, and we were able to do 42 awards. For those that are currently in partnership with us, which I think most folks really appreciated. Hopefully it helped to really get them through a really tough time that I know we're all going to be really happy to say goodbye to pretty soon, or hopefully soon. I always tell this story because I want to talk about the good in people. So I mentioned we have 70 plus grantees. And we had 42 awards that we made to those partners. And I really thought, as the lead of the grants department, that most of our grantees would say, Christy, I want to apply for these funds. And the majority did, but there were several of our grantee partners that said and had written to me and said, Christy, we appreciate BCM offering, but we're okay now. We don't want to take away from an organization that's on its last leg or providing such a critical service that we will take away from that. And so there's such humanity in the nonprofit world, people who are really thoughtful and saying, hey, we appreciate it, but you know what, we're okay. And we're going to leave that blessing for someone else. And so I wanted to share that. A couple other things I want to share with you about what we're doing beyond grant making, because we do have some direct service, I'm not saying partnerships, actually direct service programs, excuse me. Our chaplaincy services program has now come back online. So with respect to behavioral health and spiritual health, we actually employed 13 chaplains throughout our region. 4 work for the New Orleans Police Department and work with the police department covering all of the districts. And then the rest of those actually work in healthcare facilities throughout the region. And so they have really been able to return where appropriate and where possible, returning to the bedside, returning to units, helping not only to counsel and to provide spiritual support and behavioral support to patients, but to their families, as well as to those folks who are at the bedside as nurses and physicians and other healthcare staff. So we're really proud to be able to continue that commitment as well. And on our congregational wellness side, another direct service program that we have at BCM, we had launched the Pastors Behavioral Health Initiative last year. And so we have seen a huge uptick with pastors who have reached out and said, listen, I am having some concern. My congregation, my parish, they're experiencing some concern. They're experiencing trouble, and so we're offering behavioral health resources to them as well, because of course you tend to go to your pastor, your priest, someone of faith when you have trouble. So they're hearing stories of people who have passed with COVID. They're, of course, presiding over services. They're providing a lot in the way of emergency response, and that takes a toll on them personally. So we have really seen an uptick in pastors who have been reaching out to say, we want to take you up on those behavioral health services. We do offer mental health first aid. We really, felt the need to do that as a way and to be of service to the community. But I think we're seeing a lot of the same issues, Susan, that would be consistent with what you guys are seeing. I do want to make a note, though, that our board has been very intentional about saying that BCM will continue to fund. And that's a message that we have tried to make sure that our partners are aware of, that if you're in relationship with us, your payments are going to continue. There's not going to be a question about that. And so we wanted to make sure folks knew that. But then going down the road, I get tons and tons of calls and emails where people will say, are you having a fall cycle? Yes. And we're currently in the fall cycle. Are you having a spring cycle? Yes. We are currently preparing for that, which will open at the last week of January. So we also want folks to know that BCM will continue to fund in the ways in which that it has in the past. And there may be some opportunities depending on where we move with emergency response, just as the board did this past March. And thank you again, and I look forward to answering questions.
Thank you, Christy. And I'm really glad what you said at the end there, because I do feel like there are probably people on this call who don't know about y'all, right? And don't know about your grant cycles. And,
exactly.
And so we'll come back to you, because I even have questions for you, but you teed up the behavioral health and the mental health piece so well. It's a logical segue for Nick to round us out here in presentations and tell us what you're seeing and what your sense of the upcoming 6 to 12 months look like.
Thank you, Susan. And yeah, I've worked with Christy and BCM and North Shore Foundation for several years now. BCM was actually instrumental in helping us start a program on the grounds of Safe Haven run by individuals living with mental illness. So again, I'm here to talk about not only what the mental health concerns are currently and since March, but really what we're projecting to go forward. But in order to do that, I think what we need to do is we have a sound base of information of where we were pre-COVID, because, as Christy alluded to, it's not like we had the best of numbers in our community right now. So I'm just going to kind of take you through pre-COVID, what our mental health statistics look like, and then what some studies are leading us towards, and then again, some anecdotal stories. So again, in the US in any given year, mental illness, there's 1 in 5 people who experience a mental health condition, and 1 in 25 people who experience a serious mental illness. 1 in 6 youth aged 6 to 17 experience a mental health disorder each year. And the most interesting statistic that I always throw out there is what we know about mental illness is signs and symptoms are shown at a young age. So 50% of lifetime mental health cases are showing signs and symptoms by the age of 14, and 75% of those by the age of 24. And again, it's important to know that depression is actually the leading cause of disability worldwide. That's significant. The average delay for individuals between onset of symptoms and treatment is 11 years. There's no other chronic illness that exists in our world that there's an 11-year gap of symptom onset and actual treatment. And again, coming into suicide, and this is one of those things that, in St. Tammany, we've been forced to talk about a good bit. We've historically had a higher than average suicide rate, and it's been a topic throughout our community for quite some time. And just to let you know, nationwide, the overall suicide rate has actually increased 31% since 2001, 31% nationwide in the United States. Suicide is actually the second leading cause of death for people aged 10 to 34. I mean, just really let that kind of sink in. And this is all pre-COVID stuff, right? And again, for everybody else, suicide is the 10th leading cause of death in the United States. So, and I can tell you, my agency, one of the things that we do, and again, I'm the executive director of NAMI St. Tammany. NAMI is the National Alliance on Mental Illness. We primarily provide education support to people living with mental illness and their families. But one of the other things we do is we provide resources and direction to people who are not only in crisis, but in need of mental health services. And I can tell you, since March, we've seen a significant uptick, not only in the amount of calls, but the intensity and the need of individuals throughout our community. So instead of just being anecdotal, let me kind of just break into some studies that I've recently reviewed. And the issue is with mental illness and with trauma and with these types of things, we generally don't see the results of this immediately. And I'll give you an example. It's something that we can all relate to, Katrina, right? Hurricanes. What we know about the way individuals are and the way we react is we tend to have about an 18-month to 24-month delay. We know with Katrina, in 2005, right? Well, our suicide rate didn't increase until 2007. The same thing happened in 2014 post Isaac. The same thing happened in 2018 post the 16 floods. So what we know about what we can do is we can understand that how individuals in our community react to natural disasters, which again, the pandemic is not, the same thing, but we don't have a pandemic to base our data on. So we can only take the numbers that we know. So what we know is usually around that 18-month time period, we tend to see an increase in suicide, mental health issues, and overdose. We also know, as it pertains to economic downturn, there's very defined science that shows when there's an economic downturn in the United States, it's almost for every 1% in unemployment, there's an increase in suicide rate by roughly 1%. So we know if the economy is down, we know that our suicide rates increase. This is just factual. This has gone on since before the Great Depression. So let me kind of dive into some, post-COVID data. And again, the studies, it's difficult to be able to publish and do studies in 6 months. So I'm going to pull from two areas. One of them is a recent CDC report, which was conducted June 24th through June 30th, where adults reported considerably elevated adverse mental health conditions associated with COVID-19. So what we saw was overall 40% of respondents reported at least one adverse mental health or behavioral health condition, including symptoms of anxiety disorder, depressive disorder, which is at 30%, trauma-related stress disorders at 26%. And they also noted that 13% of people surveyed increased their substance use to cope with the stress or emotions related to COVID-19. That's significant, 13% of the individuals. And one of the ones that I think is the most astounding, the percentage of respondents who have reported having seriously considered suicide in the 30 days before completing the survey was at 10.7%. Prior to that, in 2019, the average was 4%. So we're more than double the percentage of individuals who are seriously considering suicide. And the thing that scares me the most as a father and as an individual that works with youth, the individuals in the age range of 18 to 24 years old, 25.5% of them, 25.5% reported having seriously considered suicide in 30 days before completing the survey. That is significant. And that is something that as a community, you know, again, mental illness doesn't care if you vote Democrat or Republican. It doesn't care if you have money. It doesn't care if you're white or black. Mental illness is an equal opportunity. And this is not just something that just affects our community, it affects the entire United States. And then I'm going to throw out just a little bit more data from, there was a recent Time magazine article which highlighted a study out of San Diego University and Florida State University that was pointing out data from 2018 to April 2020. And what it noted was U.S. adults were 8 times more likely to fit the criteria for serious mental distress. The previous number was 3.4%. The current number is 27.7%. They were 3 times more likely to fit the criteria for moderate or serious mental distress, up from 22% all the way to 70%. The differences between the 2018 and the 2020 samples appeared across all demographic groups, which larger differences among younger adults, those with children in the household. This represents a roughly 700% increase from the pre-pandemic data collected in 2018. And again, you know, I know that these stats, you know, they kind of paint a grim picture. And, you know, I don't throw this stuff out there to shock people. The good news is we know that we have time to put things in place to be able to decrease the negative outcomes that we know will be here. Unlike COVID, we can anticipate this. We can anticipate a mental health crisis, and we can implement things that might be able to prevent that. And there are many, many things out there that we can do. And I know a lot of the partners that are here are implementing those things. And again, when we get into Q&A, I can kind of get into some more of the positives, since that was, you know, so raw and down. But I guess I'll turn it back over to you, Susan.
So I'm going to start with a question. Nick, don't go anywhere, because it is just a very specific question about some of the data you just gave, and I want to better understand it before we go any further. The 2-year lag time you said we see between disasters and mental health outcomes, right?
Mm-hmm.
Is that a fair way to paraphrase what you said?
It's typically hurricanes. And again, we don't have any data in the United States to know how our society is going to act to a pandemic. We've never caused ourselves to be isolated from people at this kind of period of time. So all we can do is lean on what we know about hurricane data down here, right? Because we know how we react to hurricanes as a society. So yes, it's somewhere in that 18-month neighborhood.
So if that's sort of our historic data as it relates to natural disasters, and the current data you're seeing with the pandemic, which, as you said, we don't have any track history to figure out, the uptick of acute symptoms, if you will, acute reporting of issues, coupled with a potential of a 2-year gradual increase, those two things coupled, and they might not couple, right? They might not, but my lay mind here is coupling them. If those two things couple, that's an even that much more dire conversation than either of those two individual disparate conversations. Am I making sense in that assessment?
Yeah, most certainly. And I would agree with you on that. And I think, you know, one of the things we've noticed in the first several months, and again, you know, being part of a national organization, we hear from all across the country. And what we know in the first couple of months is people talked about being fearful, right? And now what we know in the last several months is individuals begin to talk about anxiety and loneliness. And the longer that individuals are experiencing these symptoms without any type of relief, and let me tell you, there's relief in the community. Look, one of the best things that happened with this pandemic, especially in Southern Louisiana, is now we have more access to telehealth. We have more access to reaching out to mental health providers by way of video. Now we can reach people we've never reached before. So, you know, there is support there. There are resources there. But the stats that I read off earlier, one of the stats that I didn't read off is, you know, typically in any given year, it's less than 40% of people living with mental illness actually receive care the year before they were surveyed. So you're only looking at less than 40% of people with mental illness are receiving care. Our issue is not an issue of having resources. Our issue is an issue of having awareness and decreasing the stigma so people can ask for help.
Yeah. So I'm gonna I'm going to ask you all a question, and I think everybody's answer will be very different, and it's supposed to be. Sonia, you used the word pivot, and I already had it in my script, right? Because you cannot have a call in 2020 on Zoom without using the word pivot at least twice, right? So each of the organizations or entities on this call clearly have had to figure out some ways or way or something to pivot, right? Some might be a positive, some might be a negative. But what I'm going to challenge you guys with is maybe to share with the group a pivot that would surprise us. I'm going to tell you our pivot, right? This is going to be all money for this part of the conversation. Our pivot is going to be in the next month or so. We're going to go remind our major donors and our fund holders that while there is an economic reality happening right now, if you purely look at your portfolio, just your portfolio, chances are you're okay. I mean, I don't know if anybody's paid attention to the market in the last 6 weeks. I know March was a little scary and April was too. But so we're pivoting to have a conversation with our fund holders who have not heretofore put money in their accounts this year to remind them that their portfolio is actually pretty good. Their balance sheet today might not be, and their day-to-day might be a little scary, but their portfolio is solid. So that is a pivot we are going to make with our major donors, and we're going to have those conversations appropriately with them because we need people to feel comfortable enough to move some of their money out of their portfolio and into their funds so that we can do grant making next year, right? So that's a pivot we didn't expect, but it's us getting creative and really looking at the situation with fresh eyes and figuring out a way to do something differently. Terry, you spoke to your pivot from a delivering food versus people coming to you. That may or may not have been obvious to you. Have you had any less obvious, or have you had any that you think are creative, optimistic, or just react?
I would tell you not only with the delivery, because that we didn't anticipate, we just thought when we were going to go to, a self-load that everybody could pick up the food, and that it really created a challenge for us. But the community, as I said earlier, stepped up. But I think the thing that was interesting to us, and I really have to give it to my community engagement manager, Ginger, we were very conscious of health. And because of that, and trying to get donations in, immediately we went into a virtual food donation process with Amazon, where we created our food needs and, encouraged people use this as the mechanism to get us food. And it's something that still goes on today. So, between those two, I would tell you that those things really created pivots for us, which we weren't really anticipating. And it's proven to be something that I think is going to help us long term, because it's very easy to talk about food insecurity and you need to come and see me. But really, it's the people that we don't see, and how do we get to those people? So by virtue of collaborating and partnering with different church groups, and we're trying to expand that beyond the St. Tammany area as well. We're hoping that we're going to identify people that we don't even know about, that we're able to say, hey, we can help you, and utilize the community here as well as in those areas to fight that food insecurity in those areas that can't get to us.
Yeah, that's a great example. Christy, do you have one?
Sure. Yeah. And I agree with you. I think everyone's answers will be different given, the seat with which we sit. But a couple, I think for me, and both of them are from sort of how we look at our grant making programs. I think we're seeing much more in the way of workforce and investments, and really helping to give opportunities to people who have, really been separated from the workforce. So I think that we're going to be challenged in that way to really think about it, because the other areas I mentioned, early childhood, behavioral health, those are really heavily, squarely rooted in our zones. Workforce is one, though, that's an issue. And I kind of put workforce as a big umbrella and catch all, but unemployment, those are issues that fall out of our zones. And so I think we've been challenged with how do we support the community and really meet folks where they are if they're not necessarily speaking the language that we have set up is our traditional grant making program. The other thing I'll bring up, and we've had a lot of conversation about this internally, we have the structured application. We really, give a lot of weight to evidence-based interventions and, all of these great and promising practices. And I think we have to be realistic as philanthropy. And I have just a personal belief about this, but also professionally, in that in an effort to meet folks where they are and also to acknowledge, like to Nick's point about telehealth and the fact that most of our grantees, when we surveyed them, they modified their programming and their service delivery on a dime because they had to. And so I think as applicants come to BCM and say, we would like you to consider an application, what they have now morphed to or what they've pivoted to may be something that they've really pivoted to out of need and out of an overabundance to meet folks where they are. So it may not be on its face evidence-based because the model has been shifted to say, Christy, look, I'm trying to provide people with critical services. So I think we're gonna have to be realistic about that. I think that, I know for us as a foundation, we're trying to hold a line, but not to hold one that is so unrealistic given where people are today and what they're trying to do with the folks that they serve.
Yeah, it makes great sense. And my ears hear that because we sit in the same seat sometimes. Yeah. But I bet the other 52 people on this call really feel good about that because I'm sure as a nonprofit, and particularly a small nonprofit, and particularly one who's in the middle of a pivot, just trying to take care of the people in front of them, that's probably music to their ears.
Yeah, so and that to me, I just think that's the responsibility of philanthropy of, look, we have to also walk this walk and be reasonable about what folks are going through and how can we, change what we're doing. With our emergency process, a lot of folks said, well, your transom grants are restricted. And so do I have to create a program? And I said, no, you have to complete a 2-page application and we're going to do a rapid response to be able to get those funds. And what we did, we said, we're going to cut you a check and that's it. We're not going to do this other part of it that is really going to be more of an albatross than anything for our partners.
That's great. That's great. So Sonia, obviously you've had to pivot in many of the ways you said, but is there anything sort of non-traditional that might surprise folks on the call?
Well, I will say that, we are looking at further funding, not just through our typical fundraising efforts, but what are other ways that we can draw funding that is out there, whether it's federal money or state money, to support our community. And, one of those things that we're working on is we're looking to increase an innovative revenue resource through the SNAP and ENT program, the supplemental nutrition program. There's actually funding out there where businesses and nonprofits who are doing workforce development, can y'all hear me okay? Yeah, okay. Where they are doing workforce development, and if they're doing that job training, that they can actually draw funding down to support that program through those resources. So that's, we're just looking at different things like that where we can bring additional funding in new ways, not just through our typical fundraising efforts.
Good. Nick, what about you?
Yeah, I think, with us, obviously, we were one of the first NAMIs in the country actually to move our support groups to an online platform. That was a really big thing. And the feedback from that was actually was very positive. One of the other avenues we use is we use an existing app, which the foundation supports, which was originally created for law enforcement. But we use that technology to be able to get resources up to date and in the hands of individuals in the community quicker and easier. So it was one of those avenues and one of those pieces of equipment that we just didn't typically use for that. And we said, hey, look, let's use this technology. Now, on the other end of that, and I did see there's a question here about this, I've noticed that we're mailing a lot more out because we are getting a lot of calls from individuals who are older, who are not accessing the computers, who are not accessing technology the way that everybody else is. So I find that, we're printing and mailing a lot more stuff than we would have in the past as well. So there's a population out there that, historically, I don't think have served or have needed to serve in our community that's needing help right now.
So the question Nick is answering, for those of you who haven't seen it, it was a great one, and he did begin to address it. If anyone has any other comments, is what resources are available, or is anybody working on identifying resources for isolated elderly, either in facilities or otherwise, but they're isolated because of COVID, but they don't have the technological ability to pivot, there it is again, into communicating and into access, and so the isolation is becoming even more of an issue. Anybody aware of resources or thinking through that beyond what Nick just said?
I mean, I'll throw in more on that. I mean, you know, look, all this technology stuff is all great, but we all recognize this is not the best way to interact with each other, right? I mean, this is what we're doing because we have to do it, and it's the best scenario that exists. So obviously, the best scenario that exists for our elderly individuals is to interact socially, and if individuals are in either retirement community or nursing homes, it's incumbent upon those facilities in order to provide the necessary interaction still at a safe distance that these individuals need. So, you know, I don't think there's a magical answer to that. I think the answer is, just like with anything else going on in our society, you know, let's try and answer everything we can with kindness and compassion. And, you know, let's try and be there for each other. I don't think there's any wonderful, magical thing that we can give to people other than ourselves, right? That's my answer.
That's a great one. So I'm going to pivot to another, gosh, I keep using it. I'm going to move to another question, which was actually asked first, and I intentionally waited till closer to the end because I think we can have a lot of discussion around this. And I frankly shudder to speak these words, but you know, we dodged a significant bullet that unfortunately our partners and our friends in Southwest Louisiana did not dodge. And we as a foundation are working very closely with our sister foundation in Lake Charles. Guys, they have a staff of 2. You know, I feel like I'm blessed to have a staff of 4. They have a staff of 2. To watch them begin to address and try to wrap their arms around what they're dealing with it's mind numbing. And so we're helping them as much as we can. But now all the stressors and all the resource constraints and all the things we've just talked about for the last hour and 5 minutes as it relates to COVID, what is our organizational infrastructure to handle it if a storm comes here? Terry, let's start with you.
Oh, thank you, Susan.
I mean, truly, and all of us, it really does give me great pause to ask the question, but 6 days ago, this could have been us.
Yes. And I think probably what we would have done is exactly what we did with the floods. Basically, during the time when we knew it was coming, we convened at the food bank, you know, with my leadership staff there to make prep plans as to where were we going to be once the storm passed. With regard to food and food insecurity, we tend to be, believe it or not, a little bit down the pipeline. So what we found with the disasters, what our immediate need became was cleanup supplies. So chances are what we would do is exactly what we did back then, as well as what we did just last week with Southwest Louisiana. We would go to Second Harvest and find out, first of all, what is their plan? Do they have a plan in place that we could piggyback on? Secondly, if not, who are those agencies there that we could contact and find out from them specifically what it is that they require? I think the incredible difference that we have is the pandemic, because a lot of what we are doing now and sustaining that increase creates another demand that I am not always so sure that if it did hit here, what exactly we would do other than just trying to keep serving and reaching out to the community to get us food in, to the vendors, that sort of thing. But it will change the product that we provide, as it did with the floods. Does that answer it?
Yeah.
Yeah, Susan, I would say that, you know, Kathy, I saw you ask that question, and yeah, I wasn't working with nonprofits 15 years ago when Katrina came through, and yeah, I honestly shudder to think like if that had come here, how would it be? I could definitely speak from the experiences that I've been told our United Way did at that time. And, you know, one thing that we did was we continued supporting our partners. We focused on short-term recovery, being like the stability today issues that fit into what we call our blueprint for prosperity. And then we would move into, you know, once you get to a point, and that's kind of where Southwest Louisiana is right now, is they're currently in that stability today. We need to feed people. We need to find them housing. We need to, you know, make sure that people have access to gas, you know, all of those things. And to be honest with you, we're doing much better this time around than we did 15 years ago. And that's because of that experience, right? But then hopefully we would be able to move to long-term recovery more quickly. And long-term recovery would be, you know, getting people back into safe and stable housing, helping them, businesses get back up and running as quickly as possible. You know, that's where United Way definitely comes in, is supporting our partners who are doing that stability today work so that they can do that, but then also moving toward that long-term recovery to help the community as we move forward and, you know, things coming back on board. So, I mean, I just hope and pray it doesn't come this season, that's for sure. The pandemic definitely would make it a little bit different, obviously, but it still wouldn't change the resilience of our people, that we would still help one another. That's for sure.
Christy or Nick, any comments there?
Yeah, I definitely agree with Sonia. I think, you know, I think we would certainly want to continue. I think the first thing I'm pretty sure we would do is to just double down on the commitments that we have. Very similar to what we did with COVID, giving folks kind of that very, you know, definitive, we're going to be here, we're going to continue to fund. And very similar to Katrina, where the board, you know, of course, felt really compelled to meet all of its commitments. And even with 2008, you know, when you think about the crash that was, you know, was experienced there, just giving, I think, that level of comfort in that, listen, no matter what, we're going to continue to pay, you know, frankly, I think is important. The other thing I think that we would, I think, be compelled to consider, and very similar to COVID, would be how quickly the foundation will pivot kind of to that point of what type of emergency response and where. So, you know, if we need to now move outside of the region, or if we need to really kind of focus. So I think, you know, I sort of think about this and I'm like, you know, you mentioned 6 days ago, kind of the idea that everyone was worrying and kind of waiting, but also preparing. And you think about the fact that if you add, you know, storm prep and hurricane preparation with COVID, and then you think about a region that has withstood how much in a very short period of time. I know it's not a badge we love to wear. It's not one you really want to welcome. But I think, just to Sonia's point, I mean, the fact is, if we're pushed to do that, and we definitely don't want to as a region, I know, but I know we will. You know, we've kind of been there. Some of my colleagues from across the country, they were talking about their pandemic response. And one of our national funders said, you know, I hope you guys aren't offended by this, but you guys know how to do this better than anybody. And talking about our nonprofits and not the funding community. It's like, yeah, you know, people know how to respond, they know how to help each other, and they know how to keep moving. What I would hate, and that's why I say I join all of you in that we don't want to experience this again, because I know people are just so mentally drained. You know, they're physically drained, they're mentally drained. And you wish no harm on any other region, which it is really unfortunate to see what our colleagues and our friends in Southwest Louisiana are going through. But to think about this happening, I know we will respond as a community, but you hope we won't have to. I agree. It's just,
Absolutely. Yeah. Nick, anything to add there? Yeah. So, you know, that one of the things that again, silver lining piece, right? And Christy, to your exact point, it's a little bit sad that we're getting good at this, but there is some value in getting good at this. And I will say, to all of our credit, for all the people who are on this call, not the 5 or 6 faces you're looking at, the 40 something, we started out at 50 something of you who are on this call. The mere fact that we get together and have these kinds of conversations, albeit they virtual right now, and that we have this kind of communication infrastructure, the fact that the Chamber and St. Tammany Corp and our foundation saw the value in doing this as one instead of as 3 silos. The business community is really no different than the philanthropic community, which is really no different than our hospitality industry, which is really, right? I mean, we are all one, and that's the case in any community, certainly. But I do think we should all be very, very proud of ourselves and take some comfort in the fact that just by the nature of having these kinds of conversations and the communication we already have, we could do it. We don't want to do it. None of us want to do it, but we absolutely could do it. So let me look real quick at any other questions that have come through. So one of the questions I'm looking at right now, and it is pretty relevant to everything that we hear time and time again, is it says, as a result of the pandemic and a lack of the financial resources that are now available, are conversations happening to merge any nonprofits in St. Tammany? Are those happening at a faster rate? Have any organizations expressed an interest in exploring partnerships, affiliations, or mergers? So that question is one we get often. We get it often from our fund holders. You know, Christy, as a funder, you probably both ask that question and get that question. I will just say this only as an aside to that. We know that's a very real thing. And it's why we have dedicated a pretty significant portion of the survey I told you about at the beginning of this call to do a deep dive on that and ask organizations what they believe their financial ability is to stay in business long-term right now. And then, depending on that question, are they in the process of having communications to either collaborate informally, merge formally, and everything in between to make sure their missions still get delivered? We are going to spend a lot of our time and resources on this study on that one question, because we know the importance and the critical value of the people on this call and beyond of doing what it is we do every day. And none of us as a community want to see any of those missions. We can't have any of those missions go away. So from our foundation's perspective, it is a great question, whoever asked it. We are going to get as much information in that space as we can. And the other thing we're asking nonprofits is then, if you are thinking about it, what do you need as help with that? Because frankly, that involves lawyers, that involves planning, that involves things that probably very few nonprofits on this call have the resources to pay for. So I suspect once we get those answers, Christy, that's probably a conversation you and I are going to be having.
Yes, yes, yes.
To create pots of money to help make sure we do this the best way possible.
Yeah. Yeah. And Susan, we have done that on the South Shore with 3 organizations already. And like you mentioned, with attorneys' fees and going through even in the full deep dive of each organization's audits and kind of that full sort of financial disclosure process. We've had those conversations, and then we've seen 3 actually go through the process. Now, 1 actually was contemplating that prior to COVID, and then of course COVID kind of ran them right to the finish line. But it is a very timely conversation, and I know folks will need that type of help as well
Right.
to be able to explore the conversation to see, does it work and can they preserve their mission?
Right. So I'm gonna.
I would just say, I mean, if there are other nonprofits on the line, like it does seem like after a disaster, new nonprofits pop up, right? And so if you are, if you have a mission that is similar to another nonprofit's mission, you know, maybe have the conversation. Obviously, Baptist Community Ministries, North Shore Community Foundation, United Way, we encourage that collaboration. And there could be that possibility of joining together to make your mission even greater, and have it all under, one umbrella for whatever that your focus is. So I would just share that with everybody.
That's great. You're right. One quick little bit of housekeeping, and then I'm going to close this out here. Somebody posted in the Q&A, if you all aren't looking at it, if anyone is in need of a large copy machine to make copies of or do things to distribute, Susan Spring is who posted that. So Susan, I assume you have that resource to share. So I just wanted to share that with everybody. You can all read it in the Q&A if you want to look at it. And so there are no more questions pending. And I just want to say two things here. First of all, I want to thank all of you. I want to thank the partner organization, St. Tammany Corp. I think Lacey and Chris Massengill are both on this call. So thank you both for your leadership in doing this. To the chamber specifically, Jessica is our technology expert, and she has done a fabulous job walking us through all these. This is now number 5. So thank you so much, Jessica. You're incredible. Obviously, my team, I'm a little partial, but so thank you so much to the North Shore Community Foundation staff. Leslie and John and Carla are all on the call, so thank y'all. But Nick Richard made the mistake about 3 weeks ago of saying something really, really smart in front of me. And I have stolen it completely and now used it multiple times. So I'm going to use it again, Nick, but I'm going to give you full credit for it. The truth is, in these times, really as in all times, because we are human beings, but in these times between pandemic, storms, potential storms, mental health challenges, food insecurity, financial woes, housing, at the end of the day, we all just need a little grace. So I would encourage us all just to share grace. So thank you all very much for being on this call. I'm very proud of our nonprofit sector in this region. I have an absolute privilege to be able to work with you all. We are great together, and I appreciate you all very much. And to those of you paying attention and watching who aren't in the nonprofit sector, I encourage you to learn more about us. You heard some today, but I really do encourage you to reach out to any of us, learn more, learn how you can get involved. I suspect there's some pretty good board members on this call watching that might not yet be board members. And I suspect that there are probably some donors on this call who might not yet be donors. So we encourage you all to get involved and help us all to build this community. So thank you all for your participation, and we will see you next week on the Quality of Life and Hospitality call.